The first thing you need to understand about the creative life is that not everyone's going to understand it. So what makes creativity worth fighting for? To me, creativity is a form of communication. How can I make you know what I'm thinking? How can I translate the urgency of what I'm feeling into something you will understand? Why even bother? That's the question the world likes to throw at anyone trying something different. There are many people who, over the course of your life, will try to talk you out of many things. As a kid, I knew a boy who used sign language to talk me out of bravery. He only knew one word, but spoke it so often, his hands became fists, his fists became typewriters, and he punched it into me like Braille. Everyone who saw me would read my bumps and bruises and immediately know my story. The world is full of people who will try to convince you to give up before you even start. Yoda even did that shit to Luke Skywalker. Do or do not, there is no try. The problem with that kind of wisdom is that it suggests that failure can't teach us, and that in and of itself is not wise. Failure is often a better educator than success. The trick is not to become so good at failure that it's the only thing you succeed at. The mentality we encounter is one of make no attempt. No one has ever done that before, and it is thus impossible. Shouldn't that be the very reason it's worth trying? It's like the people who say, I couldn't be happier. It makes me sad. Because basically what that means is they believe that there's a limit to their joy. Some people try to steer us away from happiness because they fear that they'll then be alone in their misery. People will even try to talk you out of love. And they'll do it believing that they're trying to protect you. They'll ask, you don't want to get hurt, do you? No. But that's the cost. That's the risk we must wager to win what we desire.
We think that smart means being human. Health is really the most human thing that there is. It's the singularly most human thing that there is. Because when you have your health, and when you have good health, a number of things happen. Health connects us. It enables us to do things that we can't normally do. It empowers us to pursue our potential and to fulfill our ambitions. It provides balance in our lives. We are very human, and our health matters fundamentally. And yet, as marketers, when we produce content, we often don't talk about it in a very human way. So often we see health content, especially in social media. It feels very clinical. It can feel very disconnected. In fact, disconnected from the very thing that healthcare providers and the solutions that they provide are designed to provide, which is make us feel more empowered, allow us to fulfill our ambitions, make us feel more connected, be totally human. And what's really amazing is if you think about the example, this is from the FDA in the States, which regulates communications. This was a generic example that they provided to the industry for what a good tweet might look like. You're a generic health brand, no focus. For mild to moderate memory loss may cause seizures in patients with a seizure disorder, and here's the URL. That is not a very human tweet. That is not the kind of thing that gets favorited or retweeted or commented on. And this is representative of the kind of content that's produced over and over and over again as we step up to the boundary of regulation and step back because we don't think human enough. And so for us, we started thinking about the reality is there are a lot of barriers in place, and they come from multiple directions: legal and compliance approval, having the right staffing in place, lack of internal alignment, lack of social access, and adverse events and regulations, things that happen in the industry. There are so many barriers to being more human and more human-centric in the communication. So with so many barriers, the real question then is, how can healthcare brands be wildly creative? How can we be more creative in a social media world?
We also have to stop censoring ourselves. So one of my favorite stories, and I can't believe I'm going to say this on stage at Cannes, but why not? There's an article about sex, which is surprising, I guess. And the blogger wrote a line where they were talking about issues that people with MS have during sex. And they were saying, how can we get excited about having sex when our vaginal walls are drier than the Sahara? And I was on a plane when I read that, and I burst out laughing, and then I turned bright red, and then I immediately went to highlight that sentence because I was about to delete it. And I had to sit and take a step back and think, wait a minute, why can't they say that? I mean, that's how they feel. You know, a pharma site would say, well, vaginal dryness is, you know, experienced by people living with MS, but that's not reality. I mean, the reality is they feel like they're drier than the Sahara, and they want to say it that way, and so we have to let them. And so a part of it is for us as communicators to stop censoring and to just sort of let it happen organically and let them speak the way that they want to speak.
And we actually no longer go online, we live online. The fact that we do live online is made possible by technology, and technology shifts power. And power has now shifted to the consumer and to the user and continues to do so more and more. And this has a very significant impact on things that we do and the patients that we talk to. As a result of this, patients become much smarter, they're faster, they're much more selective. Pharmaceutical companies, healthcare companies become much more transparent. And we end up being in an environment where we have to think very carefully about how we can communicate and what we should communicate. So as we go through this, we can no longer be thinking about interruption or one-way conversations. We have to think about how we can engage and how we can be invited in. And as you can see, life is very much no longer linear and very much a part of moments. And it's going to be critical for us to try and engage those consumers and those patients and those physicians in those moments that matter. And there are 3 ways that we're going to suggest that you actually think about doing that. So again, in order to create value and in order to engage and to be invited in, we have to do one of 3 things. We have to provide information and utility, we have to entertain, or we have to provide and build community.